Another year, another surge with COVID cases setting new records over the last few days across the nation and in this state. More than 31,000 new cases were reported over the past 3 days here in Massachusetts, with a record high average positive rate of nearly 20%. And that's just the people who were lucky enough to be able to find an official test site, with reports around the state of people waiting hours and hours to get a PCR test, if they're able to get one at all. The many who were lucky enough to find and afford rapid at-home tests and who've gotten positive results aren't even included in those numbers. But one thing's clear right now, COVID is spreading like wildfire.
I call it a tsunami of infections. When you have so many cases, even if the rate of hospitalization is lower with Omicron than it is with Delta, there's still the danger that you're going to have a surging of hospitalizations that might stress the healthcare system.
And it's not just hospital systems. Thousands of flights have been canceled due to crew members testing positive for COVID and having to quarantine, prompting Delta's CEO to request a change in quarantine procedures a couple of weeks back. And a few days after that, the CDC cut the recommended quarantine period in half, from 10 days down to 5 for people without any symptoms, a move that stirred up controversy, but which Dr. Anthony Fauci, among others, is defending.
There's no doubt that you do want to get people out into the workplace if they are without symptoms. And in the second half of a 10-day period, the likelihood of transmissibility is considerably lower. The CDC is doing their very best in trying to get the right balance of getting people back, but doing it on a solid scientific basis.
And of course, there's another piece to this latest surge.
It's unlike anything we've ever seen. Even at the peak of the prior surges, there is absolutely no way to keep Omicron out of the schools. No way.
Now, we're already seeing some schools dealing with staff shortages, student outbreaks, and a lack of available tests that are forcing cancellations, delays, and other disruptions. Still, here in Massachusetts, Governor Baker is standing firm we will not return to remote schooling.
We said for quite a while, since the beginning of the school year, in fact, all the way back to last spring, that it was critically important for kids to be in school for a number of reasons.
Now, in one bit of help, the FDA did authorize booster shots today for kids 12 to 15 and some immunocompromised kids age 5 and up. But we're still a ways away from vaccine for kids under 5. And at this point, less than 10% of kids age 5 to 17 have gotten even a single one of the doses available to them. So how do we make sure our kids are safe in schools? And what about those masks? Which one am I supposed to wear again? Joined by Joseph Allen. He's Associate Professor of Exposure Assessment Science and the Director of the Healthy Buildings Program at Harvard School of Public Health. Joseph Allen, it's good to see you again. Thanks for being here.
Good to be back, Jim.
Now, I'm a big mandate guy, vaccinations, masks, all that kind of stuff. A couple of days before Christmas, the governor joined us on our radio show, and we were part of the chorus that day that was taking issue with him about his refusal to impose a statewide mandate. You are not part of that chorus. You think he's doing the right thing. Why?
Well, I think a couple things. First, I think it's time to update the playbook for 2022. I think a lot of the non-pharmaceutical interventions, the NPIs, were the bridge to the vaccine. At this point, we've had the vaccine widely available. Hopefully people have gotten boosted. That's the number one strategy we can put in place. I think if we knew that the mask let's take a step back. Masks work. Universal masking can be effective. I think the reality of what we're seeing even in Massachusetts and Boston is that people aren't always following this mask mandate, even when it is mandated. And there's an assumption that only spread is happening in the public places where the mandates take effect. I think Omicron is spreading very rapidly. I think people who are protected, who are vaccinated, are protected against the worst effects of the virus.
Should Baker be doing anything more on a statewide basis? Michelle Wu, who'll be with me tomorrow night, just a week or so ago, decided to emulate New York and a few other jurisdictions and require vaccinations if you want to go into places like restaurants, gyms, performance venues. Should Baker be doing that statewide?
I think that's really smart. Like you, I've been an advocate for vaccine mandates going back to August. It was very clear. It's clear that vaccines are the path out of this. It's clear that the voluntary approach to vaccination hit its limit. I thought New York City was very smart in putting this in back over the summer. If you need to go into a place, a restaurant or show, you show proof of vaccination. I think Mayor Wu is smart in doing the same thing.
Since you're the healthy buildings guy, let's get back to masks in a minute and talk about schools if we can. You are, I think, part of a category of people who believe, a la Baker, that schools should remain open almost at any cost. Is that because of the test to stay notion? And by the way, for those who don't know that, normally if there's a positive test and you're in close contact, you send home to quarantine. The test to stay thing we have here says if you test negative every day, you stay in school. It apparently has saved hundreds of thousands of school days. What's the motivation for your position?
Well, I think we've gotten really narrow in terms of risk when we think about kids and schools. Kids, fortunately, are very low risk from this virus. On the other hand, the costs of kids out of school have been severe and they're accumulating. We've seen losses in literacy gains. We've seen millions of kids missing entirely from the system. Schools are the first place we detect maltreatment at home. An analysis by New York City found in just 3 months, 8,000 cases of abuse or neglect that were expected to be reported were not. Extrapolate to the country, that's 300,000 cases. Now think about what that is for the entire year. On top of that, we see kids rely on schools for meals. 14 million meals, kids were missing meals at schools. The list goes on and on. It extends to working women who've been impacted from having kids out of school, dropping out of the labor force at higher rates than men. So we've sometimes at the exclusive focus of COVID, we've neglected all these other impacts. We can keep kids and adults safe in school. These other things, we pull kids out of school, we can't keep them as safe.
But when you say it's low risk, haven't hospitalizations, pediatric hospitalizations gone up pretty dramatically during Omicron? Am I right about that?
Yeah, I'm glad you asked it because in the article I wrote for the New York Times last week, I talked about the hospitalization rate for kids, which has stayed very consistent across all of the waves, including Alpha, Delta, and even early evidence from Omicron at about or less than 1 per 100,000. That's a low rate. If you're reading headlines that say the hospitalization rate has doubled, that might be right. But if it goes from 0.2 to 0.4 per 100,000, that is a doubling. At the same time, it's in the range of 4 per million.
One last thing about schools before we move back to masks is you tweeted something the other day about an inconsistency about something I mentioned before, the reduction across the board from 10 days to 5 days for this isolation period. And finally, to Fauci's credit, he suggested over the weekend a negative test would be a nice thing. I don't have any experience in the area. It made sense to me long before he said it. But you point out that there's still CDC guidance in effect, at least there was a couple of days ago, that there's a 10-day period if you test positive in a school. 5 days in the general public, 10 days in a school. How does the CDC explain the distinction?
I don't know. It's really inconsistent to me. It reminds me of what happened with guidance for masking for adults from the summer. They set a limit on masking based on community spread for adults, didn't set something for kids, so it was masked indefinitely. Same thing here. We have one set of guidance for adults, different set of guidance for kids. Some people have argued that maybe the new guidance of 5-day applies to kids, but I've been talking to school nurses, interacting with them on social media. They're confused. If people are confused, it's bad guidance. And let me just say, I totally agree with you on the test to return strategy. I think most people in public health agree that you should test to return, test negative before you can come back. I think what the administration is dealing with is the reality that there are fewer rapid tests available, and implementing this at scale is going to be very difficult right now.
You were here about a year ago, and here's your tweet, a piece of your tweet about that appearance. Here you are. And you see what you say, confused about these kinds of masks, double masking, you're not alone. Here's my 90-second explainer. And as you probably know, nearly 500,000 people have viewed your 90-second explainer. So in an attempt to disprove that there are no second acts in American life, for those who missed it, and those who don't want to go on Twitter, they're TV kind of people, could you do another 90 seconds with whatever update you think is appropriate, since there's a mask focus right now, Joseph Allen?
Yeah, pressure's on. So let me try and hit the same notes. But the value of masks depends on the 2 F's, filtration and fit. And most people think about filtration. So let's start there. You want to use the best mask you can if you're going to wear a mask. In that case, you want one of these better masks. You've probably heard of an N95, a KN95, or a KF94. These are the highest grade masks. But I want to be careful with people. The KN95s, there's still many counterfeits out there. So if you're looking for a better mask, N95 or the KF94 out of Korea, that's the one I like to wear. And KN95s, do your homework before you do that. Second level after that are surgical masks or double masking, where you can have a surgical mask with a cloth mask on top to improve fit. After that would come a simple 3-layer cloth mask. Now, I mentioned filtration and fit. N95s, if it's hanging off your nose, off your face, a lot of gaps, isn't going to be that effective. You want to concentrate on fit. And that's where the double masking came in last year, Jim, because a lot of people were wearing surgical masks. A lot of people had cloth masks. Not many people had N95s. So what can you do in the interim? Use these cheap masks, blue surgical masks that we're all familiar with, cloth mask on top to improve the fit, and that'll improve the overall effectiveness of the mask.
Excellent. Almost as good as last year, I should say. Now, I have a couple of questions about that. Cloth mask, which you put in the third or fourth tier, whatever, cloth mask alone, not double masking. My understanding is that most of the experts are suggesting cloth masks, other than to cover a surgical mask, are virtually worthless. You don't subscribe to that notion?
Well, I've been studying personal protective equipment for a long time, and the reality is that different masks perform at different levels. And if you think about cloth masks, I don't think they're entirely ineffective. Let's say we have a 50% effective cloth mask. You and I both wear one. The combined efficiency going through 2 filters is 75%. That's pretty good. 2 surgical masks is 70%. Combined efficiency is 91%. So it's not that they're totally worthless. And I also think context matters. We talked about filtration, the 2 Fs, the filter efficiency and the fit, but context matters. So if I'm in a high-risk setting, I'm in an ICU, I want an N95 that's well-fitted. If I'm with my friends who are fully vaccinated, I don't think we need to wear a mask, but if you're in a low-risk situation, I think a 3-layer cloth mask would be okay, or a surgical mask.
How do I detect a KN95 counterfeit? Just stay away from them?
I'd be careful here. I've been warning about this since April 2020. I've written about this extensively. NIOSH and OSHA have warned about this. You can go to CDC's website, look up the mask. They've done some testing on some of these. Some of them can be good, but we've seen too many counterfeits. There's still millions that have been brought into the US early on that are still in circulation. I've seen this firsthand. So I would just be very careful. Choose an N95 if you can find it. I also like the KF94 out of Korea.
Speaking of the KF94, I was going to say to you, a viewer wrote in and asked this question, but actually it's me. I use KF94s, and I've read a number of different things about reusing them. They're not really cheap. Well, they're comparatively. They're about $1 a piece, that sort of thing. I've read you put it in a paper bag, shut the bag, let it sit there for a week, and you can ultimately reuse it up to 40 hours worth of use. Is that close to right?
Yeah, I think that's exactly right. I mean, really, the filtration efficiency is going to stay pretty good. Once the ear loops start wearing out, or your fit starts to degrade, that's where I think you have a problem. Some people are cycling in masks, say 1 or 2 days. If you put it in a bag on the side, I wouldn't seal it up. I'd let it air out a little bit, just one point there. But really, you can reuse these masks. I use my KF94 over and over. I think the context also depends. If I'm 8 hours at the hospital, then something has to be different. If I'm using it occasionally when I go to the grocery store, I will reuse a KF94 for a long time.
You know, you mentioned the 2 Fs. If I can add a third, I am of the belief that the federal government has effed the public on these tests. The notion that someday in January there might be a contract signed to have 500 million tests provided to the American people, assuming they can get them to us, they will last about 1.5 minutes. On the mask front, shouldn't the federal government be providing billions and billions and billions of masks, like a KF94, by the way, as an example, free to the American public? Isn't that the best way to deal with the mask issue?
Yeah, I think to your point, I think these are major screw-ups over the past 2 years. It's unbelievable. We find ourselves in January not being able to get a rapid test. We've been arguing for these for 1.5 years. Same thing on the mask front. It was very clear early on that we could have had these better masks, especially in the pre-vaccine era when we needed them most. And there's no reason, right? We should have had homemade masks for 1.5 years. When these things are cheap, they're easy to produce. The market had to be guaranteed by the government. Absolutely should have been delivered high efficiency masks right from the beginning. In fact, also, where's the innovation? Right, we're still dealing with these same old N95s. You're telling me the great companies we have in this country, the government with some government money couldn't develop effective masks that look cool, that are breathable for kids and adults. I mean, clearly we're way behind the ball on this. No innovation in this space at all.
Well, thank you for the second tutorial. I hope there's no need for a third. Joseph Allen, it's good to see you.
Good to see you. Thanks, Jim.